my name is Catherine Hankins. I'm a professor of public and population health at Mcgill University and co-chair of Canada's COVID-19 Immunity Task Force.
Thank you so much. So, do you think that, the fact that PCR tests are only available to, a small group of people, a few groups, do you think that this is dangerous in terms of our lack of fully understanding how many positive cases there are in Quebec?
I think it's important to try to look at the overall active monitoring that's going on and try to see how best we can move forward. So the PCR test, we want to use that for case confirmation. We want it to be for people who have symptoms, who have been exposed to people that are known to have SARS-CoV-2 infection. So what else do we have in terms of surveillance? We have wastewater surveillance. So that's looking to see if viruses are being shed in wastewater. And that, I think 60% of the Canadian population right now is covered by wastewater surveillance. So that gives us an idea if there's going to be an uptick. It's kind of an early warning indicator. And then we have a lagging indicator, which is hospitalizations, where people are sick enough that they have to go to the hospital. So we need to find things in between that can give us a good idea of what's happening. So there have been studies being done of leftover bloods that are taken for other purposes to see if people have got good antibody levels. There's a look to see among pregnant women, what are the antibody levels among them? And there'll be a study starting shortly that'll be a household study across Canada that will look at both antibodies and acute infection. You'll hear more about it in the coming weeks.
Perfect. Thank you so much. I just wanted to double check with you. The healthcare journalist at the Montreal Gazette, Aaron Durfell, he told me that wastewater surveillance wasn't being detected at the moment. Is this something that's recently started being detected again, or it was never off the table?
Well, wastewater surveillance is showing increases in different communities right across Canada. About 60% of the Canadian population is covered with wastewater surveillance, and there's a real move to get that up to 80%. The goal is to get it to 80%. The advantage is that it tells you are cases likely to be going up because it picks up virus that's coming from asymptomatic people. And they can also sequence those viruses to see what variants they are. And as you know, we've been following variants of concern, and we're watching now what's going on in Denmark, what's going on in the United Kingdom, in Europe, where this BA.2 variant is really taking off. It's more transmissible. It's replacing the earlier Omicron. So, there's cases are on the rise. Yes. So how can we best monitor how quickly that rise is increasing? And I think we need to do things such as if antigen tests are available, there has to be a way for people to report a positive result on an antigen test. Some provinces are instituting that, where you can take a picture of your antigen test that you've done at home and report that. That would be a help. But we can't simply rely on the PCR testing to tell us what's going on. We need to be using every indicator that we can.
What do you think of the Quebec government not only reducing, or I guess, removing restrictions such as capacity limits, vaccine passports, but I guess more importantly, what do you also think of the removal of the mask mandate coming up next month?
Yeah, I'm reticent to remove masks and really want people to consider using them even when the mandate gets lifted. I think, we're quite used to doing it. We know that it's easy to remember to do it now. You have an extra mask in your car or your purse or your pocket. It really does protect other people from you, and it protects you from other people. So I think if you're in a place that's poorly ventilated, don't hesitate to wear a mask, even if there's no mask mandate for that place.
And would you be willing to comment on your thoughts as to why not just Quebec, but some provinces are so, could I say, rushed to remove the mask mandates?
See, I think that people are picking up that everybody's quite tired, with all these mandates. We've been doing all of this for 2 years, and we're trying to figure out what is the way forward. One of the big things that's important now is to make sure that people who haven't yet gotten vaccinated do get vaccinated. It's so important. The most severe disease we're seeing is in unvaccinated people. So if you've had two and you haven't had your third dose, this is the time to get the third dose if you're eligible. And basically, everybody's eligible above the age of 18. It's still in that adolescent age group that there isn't a recommendation yet for a third dose. So the most important things I would say would be that, make sure your vaccinations are up to date, and then keep wearing the mask and use your own judgment as to what situations you feel comfortable going into.
Thank you so much. And I guess I just also wanted to add, how can we, the government, protect immunocompromised, elderly, and just groups that are more likely to contract COVID as the mandates and other restrictions are, I guess, loosening, ending.
Well, my understanding is that today there is COVID circulating in about 20 long-term care homes in Quebec, which is concerning. So elderly people, or I wouldn't want to say that, people, older people don't have as robust immune systems as younger people do. So we really need to do everything we can to protect them from getting exposed to COVID. And that means looking again at long-term care facilities, looking at the staffing, looking at the conditions of work for workers, making sure that people are not going from home to home, and that people are well protected, ideally vaccinated. In long-term care homes, workers should be vaccinated. And again, people coming in from the outside to visit should pay attention to being careful, to wearing masks, to washing their hands, not being the person that introduces the virus into the long-term care facility. I did hear about an interesting initiative in Quebec that a father has done to develop these little clips you can put on your mask with a red eye that indicates you're immunocompromised. And he did that because his daughter requested that be done. She was somebody who died of cancer a few months ago and wanted this. So I thought, that's a really great initiative.
That's really amazing to hear. Thank you for sharing that story. Lastly, I guess I just wanted to ask, what do you think about, I guess, the take that the removal of these restrictions, mandates, are for the sake of the economy as well as letting Quebecers get back to normal?
I think we have to balance a number of things. We've seen how important it is to keep schools open, to keep universities open. We're starting now to open up workplaces. We know for our psychological and our mental health that we need to get back to being more engaged with people in person. So I think it's good to remove sort of the lockdown curfew type of mentality, and let's see if we can move forward wearing masks and being well vaccinated and paying attention to see if we can open up our society more. It's a challenge for all of us, and it's not an easy time, but we have the seasons in our favor. We're moving into spring now and into summer, which hopefully will make the next wave less of a wave. If this is a sixth wave starting, hopefully it'll be a blunted sixth wave because we'll be able to be outside and in less closed spaces.
Thank you so much. Is there anything that I didn't ask that you'd like to share at all?
No, I would just really recommend that people make sure their vaccinations are up to date. This is the best protection they can have, is to get that third dose if they haven't done it, to get vaccinated if they haven't done so yet, and to continue to wear masks when they're in closed spaces where the ventilation isn't good, large crowds, that kind of thing.